going to be your nurse practitioner. Can you tell me your name, your date of birth?
Kevin Willis, 4/15/92.
Perfect. And is it okay if we video this?
Yes.
Okay, I'm going to wash my hands and start the assessment. First, I'm going to inspect his hair for symmetry and distribution. Then I'm going to inspect his head for symmetry, for any rashes, lesions. Then I'm going to palpate his head for any depressions, hematomas, lumps, bumps, symmetry, everything is symmetrical. Next, I'm going to move on to the eyes. And I'm going to test visual acuity with optic nerve number 2, which is the cranial nerve. Tell me your name and your date of birth.
Kevin.
One more time, okay? And then if I don't do it, then I'll just fail. Okay.
You just fail?
It's okay, yes.
No, you won't.
Nurse practitioner, can you tell me your name and date of birth?
Kevin Willis, 4/15/92.
Okay, do I have your consent to video this exam?
Yes.
Okay, so I'm going to wash my hands, start my assessment. First, I'm going to inspect your hair for symmetry and distribution. Next, I'm going to inspect your head for symmetry, any rashes, any lesions. And then I'm going to palpate his head, feeling for symmetry, any depressions, any hematomas, none of which I feel. Everything feels nice and symmetrical. And then I'm going to move on to my eyes. I'm going to start with visual acuity, which is cranial nerve number 2, the optic nerve. I'm going to use my Snellen chart, and since I have the handheld, I would have the patient 6 feet from me. If I had the wall chart, they would be 20 feet from me. So I'm going to have you cover one eye, read the lowest line you can see.
LTFPH.
Okay, next eye.
LTFPH.
And both.
LTFPH.
His visual fields. So I'm going to have you tell me when you can see my hands.
Yes.
I'm going to inspect his eyes. So first I'm going to start with inspecting his eyelids, looking for any exophthalmos or ptosis, neither of which I see. And then I'm going to move on to the conjunctiva and the lacrimal system. So I'm just going to pull down in his lower eyelids here and peek at his conjunctiva. No issues there. And then I'm going to move on to the iris, the sclera, and the cornea. So I am looking here, and your sclera, his sclera looks nice and clear, no jaundice, no redness, everything looks good there. After that, I'm going to move on to my pupillary responses. Let's go. And I'm going to do direct pupillary responses. So first I'm going to shine a light here. Perfect constriction. Okay. Pupils are equal, round, reactive to light. Next I'm going to test by indirectly placing the light source in the left eye and checking for consensual reaction to the opposite pupil. So left eye looking for the right response, perfect, and right eye looking for the left, okay? So they were consensually reactive to light there. After that, I'm going to move on to my 6 cardinal gazes, which cover cranial nerves 3, oculomotor, cranial nerves 4, trochlear, and cranial nerve 6, abducens. So abducens is going to be our lateral eye movements. Cranial nerve 4, which is trochlear, is going to be our down and medial eye movement. And cranial nerve 3 is going to cover all other of the cardinal gazes. So what I'm going to have you do is I'm going to have you follow my finger with your eyes without moving your head. So I'm going to go out, up, down. Okay. Looks good there. Next I'm going to test convergence. So I'm going to have you follow my finger into your nose. Test accommodation. So I'm going to have you look at my finger and then look past me at a distant object. And with this, I'm just testing that his pupils respond appropriately to looking at the distance. Okay, and I'm also noting any nystagmus, but I do not see any beats of nystagmus. Okay, after that, we are going to go to our ophthalmoscope assessment. So I'm going to dim the lights, and then I'm going to practice safety with right eye to right eye and left eye to left eye. So your left eye's here, so I'm going to go ahead with my left eye first, and I'm going to find the red reflex and look for the vessels. I'm going to look for the optic disc and cup and the lens and the retina. To right eye, so I'm going to go here, find the red reflex, and then same thing, I'm going to look for the optic disc and cup, the lens, the retina, and the vessels. So the optic disc and cup ratio should be 3 to 1. The margin should be sharp, and the color should be an orange. With the vessels, I didn't see any AV nicking or cotton wool spots. Okay, so at that point I would turn the lights back on to normal, and I'm going to start inspecting the nose. First, I'm going to inspect the nose for symmetry, any nasal deviation, which I don't know, and then I'm going to palpate for tenderness. Do you have any tenderness? Then I'm going to palpate his frontal and maxillary sinuses. Any tenderness with that? Okay. All right. After that, I'm going to do my smell test, which is cranial nerve number 1, olfactory. All right, so you occlude one nostril for me and tell me what you smell here.
7.
Next. And I'm going to use my light source, and I'm going to shine my light in his nares, into either nares, and I'm just looking at the nasal mucosa and turbinates. So I'm going to move on to the ears. So with the ears, I'm going to do the whisper test, and I'm testing cranial nerve number 8, which is vestibular cochlear. So I'm going to have you go ahead and close this ear for me. Either one, yeah, that's fine. And then I'm going to whisper just a simple term and make sure that he can hear it. Baseball. Next ear. Okay. Take my tuning fork. I'm going to lightly strike, and I'm going to do the Weber test. The Weber test is looking for any conductive hearing loss. Forehead. Does it feel the same on either side? Can you hear the same on either side? Okay, so it should sound the same on either side. So that is a normal finding with no conductive hearing loss. Next, I'm going to do the Wren test. So I'm going to strike my tuning fork again, and this is going to test for both types of hearing loss. Okay, so I'm going to place my tuning fork on the mastoid bone. You tell me when you can't hear it anymore.
Can't hear it.
Okay, can you hear it here?
Yes.
Okay, so that's an appropriate finding again because air conduction should be greater than bone conduction. Okay, so with hearing, I'm going to inspect both ears, and I'm going to palpate ears and tragus. So I'm going to palpate here in the tragus, inspect, palpate. Equipment here. I'm going to do my otoscopic exam. I'm going to pull up and back. I'm just going to pull up and back and look at your ears. Tympanic membrane, which is nice and pearly gray. Looking at the cone of light, which is which is at 5 o'clock on, but it's 7 o'clock on the left. And looking. And this ear is actually at 5, which is appropriate. And again, the malleus venous. With the ears, I'm going to move on to the mouth. Okay, so I am going to inspect your mouth. I'm just going to get rid of this and then use this as my light source. So I'm first going to look at the lips, look nice and symmetrical, not dry. And then I'm going to have him open his mouth. Once I do, I'll gingiva. I'm going to look at the salivary duct openings and the tongue and look at the papilla there. And then after that, I'm going to test 2 more cranial nerves, so I'll explain that. The pink and moist, no dryness, no redness, everything looks good. Okay, I'm gonna have you say ah. Okay, and there I'm looking for the soft palate and the uvula, which is cranial nerves 9, glossopharyngeal, and 10 vagus. And then I also took a peek at the posterior pharynx and the tonsils. Everything looked within normal limits. I'm going to test cranial nerve 12, hypoglossal, and I'm going to have you stick out your tongue and look for that it's midline. And then after that, I'm going to have you push in against my hand with your tongue. Good and symmetrical there. I am going to move on to the neck. All right, so I'm going to have you flex down with your neck. Okay, and then I'm gonna have you rotate to the side, rotate to the side. Okay, and then this lateral movement, down and down. And then I'm gonna test cranial nerve 11, which is accessory. I'm going to have him turn his head against resistance with my hands, and that's going to test the sternoclaviculoid. Okay. Turn that way. Okay, and this way. Okay, and then the trapezius, shoulder shoulders against resistance. Okay, everything was good there. After that, I am going to move on to my lymph node assessment. Okay, so I am going to start with my, down here a little bit. Okay, so my submandibular here, my submental here, my pre-auricular, go to my occipital, tonsillar, anterior, cervical, posterior, cervical, and then my supraclavicular. Okay, and I don't feel any swollen nodes. Everything feels nice and normal there. I'm going to look for any trachea deviation, which I do not see. And after that, I'm going to move on to my thyroid exam. So first thing is I'm going to look at the thyroid tangentially. Yeah, okay. And then I'm going to have you swallow. Okay? And then I'm going to identify the landmarks to find the thyroid, which I can palpate here. Okay? And then from behind, holding his thyroid from behind, I'm going to have him swallow. Okay, and I don't feel any lumps, any lesions, anything abnormal, any nodules there. Exam.